Congressman McHenry, welcome.
Thanks, Evan.
The Supreme Court is set to rule next month on whether subsidies provided through the federal exchanges are legal under Obamacare. If they throw out those subsidies, that could leave thousands of North Carolinians without health insurance. What would be your plan to replace that?
Well, that's what we're working through in the House of Representatives. The question is whether or not the question is whether or not the Supreme Court is going to rule that subsidies aren't constitutional and not consistent with the law. But if they do, we'll have a credible plan in the House of Representatives that transitions us, if I may say, back to a patient-centered, doctor-centered approach, which puts the control in individuals' hands. The idea of a healthcare exchange is not necessarily a bad one. The question is how you limit those that can qualify into the exchange. What I think the answer will be, and a component of it will be, is a broader array of choices within the healthcare marketplace. So individuals can actually have a wider assortment of plans that really fit with their families' needs and individuals' needs. Now, we'll have a transition period between what is the current regime, which I think is a very flawed one, and over a period of 18 months to a year, transition to this new regime that actually puts individuals in charge of this process, not outsource it to government and limitations that are currently in place under Obamacare.
But is the lack of a solid plan in place by the time that the Supreme Court may rule, doesn't that put Republicans in a bad place with people thinking this is maybe just too political?
Well, if we don't have a plan, that certainly puts me and my party in a bad place. We have a plan. We're working through the details and trying to make sure that that's all fully fleshed out before we go public. If the Supreme Court rules, what I would hope is they would rule correctly on this, and then we have the opportunity to have major reforms to what is Obamacare.
Okay, we'll see what that looks like. Governor McCrory just vetoed a bill that would allow magistrates to opt out of performing marriages if they have a religious objection to same-sex marriages. The Supreme Court is ruling on a same-sex case next month. How do you feel about same-sex marriage?
Well, I support traditional marriage. Look, that's my view. I know others have a disagreement and a different worldview. I certainly respect other people's opinions, but that's my view. Certainly what's going through the courts right now will actually either put same-sex marriage in a different legal footing than it currently is, and I'm watching the case very closely.
Finally, how do you feel? Some of our viewers have been asking on our Facebook page what your thoughts are on the decriminalization or legalization of marijuana. I'm
not in favor of it. I don't see sound economic reasons or law enforcement reasons to do that. And I know others have a firm desire to have the option for themselves. I have some greater concerns about the law enforcement capacity through these legalization means. We also have the states that have undertaken this have an enormous challenge with trying to regulate it. And in a time where health care is coming to the fore and cigarette smoking is on the decline, the idea of actually having other ways of harming your lungs and harming your body is, I don't think, the best approach.
Well, we have a number more prisoners in our prisons than any other country in the world. We see a third of those prisoners are there for drug-related crimes, and we know that other countries like the Netherlands and Portugal have come up with some creative ways about legalizing drugs that have resulted in a decrease in violent crimes. Does that not, with the war on drugs being what it is, does that not appeal in some way to you?
No, because you still have the violence that occurs with the drug trade. You certainly have the societal harm that is as a result of those who become addicted to these drugs, and I think it's a grave concern. So to me, I don't think it's the right approach.
Okay, Congressman McHenry, thank you very much for joining us. We very much appreciate it.